Do you have irritable bowel syndrome? If so, you're not alone. 15 to 20% of Americans suffer from IBS. And April is IBS Awareness Month, and a new diet can help reduce and even eliminate symptoms. Dr. Rachel Pauls joins us now. And for people out there who don't necessarily know what IBS is, it may not sound pleasant to talk about, but what exactly is it?
Yeah, so IBS, or irritable bowel syndrome, is, as you said, a super common problem. Somewhere between 30 and 40 million Americans suffer from it. And it can include symptoms such as gas, bloating, diarrhea, constipation, and just discomfort in the abdominal area for no other reason.
Which sounds like something that, you know, any average person could have, but it's to a certain, it's a whole different level when we're talking IBS, isn't it?
Yeah, I mean, typically patients or people that have IBS, they will report more distress or more of a daily or weekly issue with those things, not just the occasional, you know, I've had a bad chili the other day.
Right, exactly. So you have actually developed a really good kind of roadmap for people with IBS to make life normal again, right?
Right. So Eric, actually, I personally have IBS, and about 5 years ago, I discovered a way of eating called low FODMAP, which essentially changed my life. It alleviated all my symptoms. It was like a cloud had been lifted from my life. And so through eating that way and cooking that way, I came up with a recipe for some energy bars that I thought were delicious, healthy, good for you. And then as it just happened, we ended up creating a company in order to produce them, and they're called Happy Bars. And we have some of them here.
Got a few of them here, yep.
And then I brought some low FODMAP foods for people to look at. So FODMAPs are carbohydrates that are in foods that we eat very commonly. So they're in a lot of different food groups, and they're difficult to digest, and as a result, they can kind of cause those symptoms of IBS. So if you take those out of your diet, you can actually improve your symptoms dramatically. 80% of people that follow the diet have response, which is greater than medications or other treatments.
Yeah, and you mentioned a cloud being lifted. You said before this, like you said, it really could wipe you out for a couple of days, but now you really live life pretty normally, right?
Yeah, I completely live normally. This is just kind of an integrated part of my life now. You can see there's amazing fruits, vegetables. There's a lot of products that are in the gluten-free variety that are also low FODMAP, so that makes life a lot easier. And then being in the kitchen, I've created a lot of recipes, which I'm sharing on my blog. For example, a granola recipe that's just delicious, and some of the ingredients are on the table here, too.
Yeah, there's a really nice wide range of food that's here, and I think one of the things that's interesting about IBS is there's still a lot that's kind of unknown about it, isn't it? Because there's a lot of research being done, and this is something that you may not have growing up in your teens, your 20s, and even 30s. It can develop later in life.
Yeah, absolutely. And I think, speaking to what you were saying about how common some of these conditions or symptoms can be intermittently, a lot of people don't end up going to their doctor and kind of expressing the true range of their symptoms or getting diagnosed. They say 11% of people might wait 10 years to go to their doctor. So kind of suffering in silence, and it shouldn't have to be that way. It can develop at any age, from children on through adulthood.
So I guess the message there is don't be afraid to share your symptoms with the doctor and hopefully get diagnosed, and then this could really help you out. Rachel, thank you so much.
Oh, thank you. I really enjoyed being here.
Hopefully this helps some people out there as well.